What is respiratory arrest? It occurs when a victim has pulse but is not breathing. Causes could be due to obstruction, asthmatic attack, cardiac arrest, cardiogenic shock, inhalation of smokes and fumes. Signs could be pale skin, cyanosis, consciousness changes, and breathing difficulties. I will firstly start off by explaining the BLS survey when assessing a possible victim of respiratory arrest. Firstly, check the responsiveness by shaking and shouting, "Are you okay?" And then check for breathing. If breathing is absent, continue with survey. Which leads to the second point, which is to get help by calling the EMS. Then proceed to the third point. This is to check pulse. This can be done by assessing the pulse for 5 to 10 seconds. There could be two possibilities, where pulse is found and where pulse is not found. In case where pulse is found, start rescue breathing. 1 breath every 5 to 6 seconds should be given. Then check pulse every 2 minutes. In case where there's no pulse, start CPR by doing 30 compressions per 2 breaths at a depth of 2 inches. At least 100 compressions should be done per minute. The final step would be to do defibrillation. In this scenario, a victim of respiratory arrest has been found lying on the floor with no breathing to be found. The first step to do is to check the consciousness of the victim. If the victim is unresponsive, immediately call for help. Then proceed to check the pulse. In this case, pulse is present. Proceed to put on your personal protective equipment. Once PPE have been worn, use the head tilt chin lift method by pulling the mandible up. This lifts the tongue away from the posterior pharynx and improves the airway potency. In situations where ambu bag is not present, use mask with a filter and a one-way valve. Give 1 rescue breath every 5 to 6 seconds. Continue to monitor the patient's consciousness and repeat until the patient has responded to the rescue breaths. To conclude, the patient was found unresponsive and had respiratory arrest without airway obstruction. When pulse checked, patient is most likely tachycardia with 80 beats per minute. Using chin lift method, rescue breaths were given effectively.
Laughter is the best medicine, guys.